Everyone. So today we are going to discuss the IVF process because 25th July is considered as the World IVF Day. This day is particularly chosen for the IVF Day in order to celebrate the birth of the first IVF child of the world, who was Louis Brown, who was born on 25th July 1978. So it's 40 plus years, and that is why to celebrate the IVF process we celebrate today on 25th July. So I would like to use this day to help you to understand from the very basics in very simple terms what is IVF and how do we actually do it. So IVF means in vitro fertilization. In vitro means lab fertilization, and in vivo means in the natural body what is happening. So this word is very important, in vitro fertilization, because the fertilization is the process where the egg of the female meets the sperm of the male. This process is called as fertilization, and this process is being done in the lab, and that is why it is called as IVF or the test tube babies. So how do we start it? So whenever the couple has previous multiple failed attempts of IUI or any significant other factors like severe low ovarian reserve, or the male factor is severely low, or the bilateral tubes are blocked, in those cases IVF is the best option, because it not only is very simple nowadays, it is not only very pocket friendly, but it also gives a good percentage of success as compared to the other process. So how do we start? The first step is always the ovarian stimulation, and this is one of the most important steps, because once the number of eggs are actually formed and they are retrieved, it is same number of eggs which will keep working for you for at least 2 years, because we will freeze the extra embryos. So this step is very important. Ovarian stimulation is done by the medicines, and of course a high dose of injections is given. Multiple follicular study will be done to know the progress of how many eggs are forming. Accordingly the blood test will also be given, and accordingly other injections will also be added to get the maximum number and the best quality of the eggs. Once your eggs are mature, a trigger injection will be given, and after that this egg retrieval procedure is done. This egg retrieval or egg pickup is a very simple procedure, but it is done under anesthesia, through which a simple needle is put through the vagina, and then from that needle we actually aspirate both the eggs which are formed in the ovaries. Those eggs are immediately taken into a tube, and the embryologist in the lab will see actual how many eggs are of good quality. Immediately from the husband, the semen sample is collected, the best sperm is chosen, and this you can see it is an egg, and the best sperm is actually injected inside the cytoplasm of the egg. This is the main procedure. The fertilization is happening in the lab. This is why it is called as IVF. This procedure is basically called as ICSI. So you would have seen IVF ICSI, because nowadays ICSI is the procedure of intracytoplasmic sperm injection. So in the cytoplasm the sperm is injected, and then the fertilization is happening. So if example a female had approximately 15, out of 15 only there will be like 10 good eggs. Out of this 10 good eggs, only the embryos will come down to approximately 5 to 7. So that is the reason we stimulate with the maximum number of doses, because we know that ultimately the numbers will fall in the process. And finally the embryos is formed in the lab. This is a blastocyst, which is called as a day 5 embryo. Many embryos will not reach this stage. They can be like up to day 2 or day 3, but any embryo which is reaching a day 5 is the best. In that also grading of the embryos is done by an embryologist. After this, most of the times now we are doing a frozen cycle. So when this blastocyst has formed, this embryo will be frozen in the labs itself. There's a nitrogen cylinders in which the freezing will happen. Okay, after that the patient will allow to have her periods. Then after the periods the focus will be done on the uterine lining, because the uterine lining has to be very favorable for the embryo. So after that lot of medicines will be given for the forming of the lining. Now we are not bothered about these eggs. Now we are not bothered about the ovaries. After that, when the optimal thickness minimum is 6 mm, but of course if it is 7 to 9, it is more good. The vascularity is also confirmed, and that day this which was frozen embryo is actually thawed. Okay, it is like defroze or it is thawed, and then it is put into the uterus. This is a very simple procedure basically, but the success mainly depends on the quality of the embryo and the thickness and the quality of the lining of the uterus. So both of this has to be in synchrony. And after that, after the embryo transfer, the pregnancy test will be done 14 days after that. Okay, so that is very important. After 14 days, the pregnancy test will be done. Okay, and nowadays we are actually shifting to single embryo transfer rather than double embryos to decrease the chances of multiple pregnancies. The quality of the embryo is very important. We are focusing on single embryo transfer for a better synchronization between the lining of the uterus and the embryo. There is a high chance of implantation whenever the euploid embryos are there, and that reduces the chances of multiple pregnancies, and it is very much mimicking a natural conception. So this is in brief, it is telling you everything in for what is the procedure of IVF. For any more detailed understanding, you can please WhatsApp me on the same number. Thank you.